Welcome to the Circuspreneur Podcast. I'm your host, Shenea Stiletto. My guest on today's episode of the Circuspreneur Podcast is Founder, Chief Advocacy, and Innovation Officer of Cure for the Kids Foundation, Annette Logan-Parker, and also Amber Williams, who is the Director of Communications for Cure for the Kids, and she also began as their event manager. Welcome both to the podcast.
Thank you for having us.
Yeah, thank you so much. It's an honor to be here.
You're so welcome. It's such an honor to have you both here. I'm so excited to discuss Cure for the Kids Foundation and also to Circus Couture, which is an amazing charitable event that happens every single year in Las Vegas for over a decade now. Annette Logan-Parker of Cure for the Kids Foundation, Nevada's first and only tax-exempt childhood cancer treatment center, is served as the CEO since founding C4K in 2006. She is known for pioneering and directing her efforts to transform the way children with cancer in Nevada receive healthcare by creating the original mission and vision of C4K in 2006. As Chief Advocacy and Innovation Officer, Logan-Parker advocates for the medical needs and services of pediatric cancer and rare disease patients with lawmakers at the local, state, and national levels. She also focuses on developing a strategic plan to enhance C4K's ability to serve an increasing number of patients and expand research opportunities, including donor engagement and physician recruitment. Annette Logan-Parker is also chairperson of the board of directors for Cure for the Kids Foundation. Logan-Parker is an international disruptor, always inspiring the organization to be more innovative. She pushes for extreme creativity, and she delights in the assignment of doing what others consider impossible. She challenges her team to be excellent by focusing on the difference between what is and what should be, and they have risen to the occasion. C4K holds the gold standard of accreditation from the Joint Commission for their clinical operation, as well as the premier clinical laboratory accreditation from COLA, ensuring that the children of Nevada receive the highest quality of healthcare available. Since the inception of C4K, over 70,000 patients have been cared for, and not one child has been turned away for their family's inability to pay for medical care. Additionally, Cure for the Kids cordially invites you to join them for the 13th Annual Circus Couture event titled Once Upon a Time. This enchanting evening promises to be one of Las Vegas's most anticipated charity events, blending the mesmerizing worlds of circus, art, and fashion. Prepare to be captivated by award-winning performers and renowned producers from the Las Vegas Strip, all united in support of the Cure for the Kids Foundation. Aerialists, couture designers, performers, and fine artists will come together to engage with prominent leaders and philanthropists, making this a unique and unforgettable night of entertainment. Don't miss your chance to be a part of this magical experience. Wow, that was just like absolutely amazing and phenomenal. And I'm so excited to discuss the background of Cure for the Kids and how everything really began to get us to this point where you started to do circus couture and kind of blend your philanthropic efforts with local Vegas talent, which I think is really special in the blending of those two and partnering them and how they both can, very much support one another. I think it's a really wonderful pairing, and I have since I started hearing about circus couture several years ago. I know that we went very extensively into your background, Annette, and it also, Amber, if you could let listeners know a little bit more about your background and your connection to to Cure for the Kids. Excuse me.
Sure. I started at Cure for the Kids in 2017 as the events manager, like Annette said, and I did circus couture for a couple years. I handled all of our fundraisers at that point. And then about 2 years into being with the clinic, I kind of moved over to support Annette. So that's what I've been doing for the last 5 years. I kind of help her with any of her initiatives, which you can tell she's involved in a lot of things.
Yes, many things.
Many things.
Wow.
We really don't know what our day is going to look like, and I love it so much. So I've been so honored to be in this role under her.
That's amazing. And Annette, how did you start Cure for the Kids? I mean, with the incredible, amazing effort that it's turned to now. Where did you start, and what was your inspiration for originally starting Cure for the Kids? It's such an amazing effort, and just really incredible.
Well, thank you. Yeah, it's a question I get asked often.
Mm,
So I'm a nurse by training, and I had been in corporate healthcare an entire career, and had a child who had a pretty significant catastrophic medical situation. I was like to stop and pause there. He's fine. He's healthy. We had an excellent
mm,
outcome. We just had a terrible journey getting to the excellent outcome. And
mm,
so, when you are in healthcare, and I always say, when you see healthcare from a vertical perception, meaning you're standing up and you're taking care of healthcare, it's very different when you're horizontal, meaning when you're in the bed as the
mm.
patient, or in my case, as the patient's parent. It really became clear to me how fragmented services were in Las Vegas at the time, how the system really wasn't built in a way to kind of shepherd parents and children through these really complex medical scenarios. And I was in healthcare and I knew the language, right? I knew the landscape, and it was still very challenging for me to get my son what he needed. And so after 4 years and 20 surgeries and maxing out two different $1 million policies prior to the Affordable Care Act,
Oh,
he's better. And I had an opportunity to say, okay, now what do I want to do with this newfound information, this newfound knowledge that I gained from being a parent of a child fighting for his life in a community that is not known for progressive and innovative healthcare? That's what Las Vegas looked like in all those years ago, right? So in 2006, Cure for the Kids started as an idea. Oftentimes people hear the story of, I was at Applebee's with a physician friend of mine, and we wrote out our original plan on a napkin over lunch at Applebee's. And from that conversation, it just kind of grew and grew and grew to what it is today. I started from the kitchen table, figuring out, if I had a magic wand and could wave it, what would it look like for kids who are sick in Nevada? And then I just went to work, and here we are all these years later. Really known as a regional center. We see children from all of Nevada, parts of Arizona, California, and Utah now. So, it literally started as kind of a mom on a mission. Um,
mm.
and, it's been a great and very rewarding journey to be part of. It's not really ever been easy. I can tell you that. Starting a nonprofit children's cancer and rare disease treatment center is not for the faint of heart. I can tell you
Can
that.
imagine.
Yeah. And so that's
Absolutely.
kind of the genesis of how Cure for the Kids started. And I was really, really lucky because early on in that experience, I met Erica Linz and Dawn Marie Bernard
Mm,
and Lisa Harding, and they are the three who really wanted to start something unique. Back in 2006, I think it was, one of the Cirque du Soleil family members had a child who had childhood cancer who did not survive. And so that
oh,
really spearheaded the uh, talent in Las Vegas. And so
mm,
Erica and Dawn Marie and Lisa went together and said, how can we either raise awareness or raise money or different things like that? So our worlds collided early on in my starting Cure for the Kids. And, they were very passionate. I used to call them the charity cowgirls, right? Because they were mavericks in their vision for fundraising and their vision for bringing their talent and their really unique skill set as being in the circus world, to help me raise money to make sure that kids in Las Vegas get the care that they need locally right here at home. And that's kind of how it started. And, this is our 13th year. We've been at it for 15. We had 2 years off
mm,
because of the pandemic.
mm,
But those three wonderful women are the ones who really were the bridge in bringing the talent and all of the different amazing people from the Las Vegas Strip into my world to help me raise money for the local kids of Las Vegas. Kind of
Wow. And
divine
I mean,
intervention, really.
yes, it sounds like it. It sounds so synchronistic and like such a miracle in coming together and, yeah, very kismet. And you are able to raise so much money. I mean, and I can't imagine how expensive it is to run a nonprofit in this way where all the children are getting all of their medical expenses paid for. So you basically can go and it's all for free. That's correct, right? Right, Annette? You
Yeah.
don't, they,
Well,
parents don't have to
it's
come out
not
of
free.
pocket?
It's not a free clinic. It's a
Okay.
charitable clinic. So it's a tax exempt. So
Okay.
we are a
Okay.
medical institution, no different
Hmm.
than Steinberg Diagnostics or even Sunrise Hospital. That Sunrise Hospital is a publicly traded for-profit hospital. We just chose
Hmm.
tax exemption as a strategy. So we bill and collect for services with major insurance companies, just like any other healthcare institution would. It's what we do with our revenue that sets us apart. So any excess revenue, if we're lucky enough to have any, which most years we
Mm.
don't, that's why philanthropy is such an important part of what we do. So
Hmm.
rather than the practice of medicine and then owners or shareholder return or Wall Street investor return, the revenue goes to advancing the mission and vision of the organization. And so the good news is, because we have a close to a $50 million annual budget every year now. We didn't start out that way, but we are that
Oh
way
my
now.
God.
And there's no way
Mm.
for us to raise that kind of money through philanthropy in Las Vegas. But what we do is
Hmm.
we use events like Circus Couture, and we write grants, and we have other philanthropic contributions that allow us to provide services that aren't normally covered by insurance companies. And those are the resources that have helped me recruit physicians to come here. When we started, we had one doctor, one nurse practitioner. Now we have 19 providers overall. We started with 5 employees, and now we have over 150 employees. We started out seeing a few hundred children every year. Now we see thousands of children every year. And so the business model really was designed to take the best of what corporate healthcare has to offer with
Hmm.
standards and research and infection control and patient safety standards and initiatives, but it marries charity and the heart of philanthropy, so that what we can do is we bring those two worlds together at Cure for the Kids, so that the local kids of this region can have the best possible care that they deserve. We all know all these kids deserve the best possible technology, the best possible treatment options. And so philanthropy allows us to do that.
So would you say it's a supplement for care
It
to
is. It is.
expand
We
in
use
expanding in care?
Yeah. So tax exemption was always that business strategy, because we know that childhood cancer and rare disease care is very expensive. And even
Yes.
for families who have insurance, it can become very
Hmm.
expensive, particularly before
Hmm.
the Affordable Care Act. People were maxing out policies like I did twice in the 4-year period of time with my son. I had to change jobs in order to keep him insured. So that's
Wow.
tricky. So even people who have what we would consider, um, middle income, right? Like had a
Hmm.
middle income, still run into problems, because oftentimes what happens, one parent needs to quit their job to become the primary caregiver. There's co-pays, there's travel, there's out-of-pocket expenses, and that all accumulates as well. So it's not, our charity care isn't just for completely uninsured or undocumented or anything tragic like that. A lot of our charity
Hmm.
care helps everyday average families stay in their
Mm.
home so they don't have to file bankruptcy. And those are the things that happen when you have a child with this type of medical situation. And so that's why tax exemption is really, really important for this particular type of patient population.
That is so hard. I mean, parents and families that are insured and still what they're up against in terms of getting their children the care that they need to survive these egregious diseases. I mean, I think that's just wild. I think that it's just exceptional to see that there are environments that are taking care of, these environments too. But I just can't imagine, having access to all of these things and still not being able to fully, take care of your own child when they're in so much need. Well, and transitioning into Circus Couture, I'd love to understand how you blend in the efforts of Cure for the Kids into the elements of Circus Couture and kind of highlight, all of these beautiful things that you do within the organization with this event that happens once a year.
Absolutely. Over the years, it's evolved and it's become a lot of fun. We often have children from the clinic participate in the show. A lot of the children make art items. So we've really been able to introduce art to the kids at the clinic through the Domsky Glass Studios. They'll do art parties where they can make art with glass. We've had painting parties. This year we have a featured artist who came and spent some time at the clinic and taught the kids how to use alcohol ink as a medium, and they did a collaborative piece. And so we bring the kids in a lot. And what's interesting is over the years, the folks who really put on Circus Couture, who are our volunteers, they volunteer at the clinic in a variety of ways. It's become our clinic, right? Our community's clinic. And so it's been a lot of fun. I mean, one year we did a music video with our kids, and the talent
Oh,
from Circus Couture was able to help with the production of that and the choreography of that. And so, we use their talent for everything from hair and makeup to lighting to rigging to carpentry to front of house and back of house. I mean, there's so much talent that comes together to raise money for the kids of Las Vegas every year. And it's become quite a family affair. I mean, some of these people, like I said, I've known for 15 years. They're my dear friends and family. And so it's been a lot of fun to bridge it. And, every year we try to bring an element of the clinic, and we've gotten better at this over the last few years, where we bring story element in. This year particularly is going to be a really fun year because we're telling the story. I don't want to give too much of it away, but we're telling the story of a child who fought and won their battle with childhood cancer. And so, it's really been cool to watch the talent and evolve. One year we tasked the designers to look at cancer cells under a microscope and then design some of their featured
oh.
items around these cancers. Because what's really interesting about when you look at cancer cells under the microscope, it's like art. It's kind of it's terrible to say that, but they can be beautiful scenes under the microscope. And so that was a fun year where we brought some of that in. And, we have one of our dream themes would be to really, truly dig deep and tell the story of the journey of a child with cancer. So it's been cool to bring a little element of medicine onto the stage.
Oh, that's just like darling.
Yeah,
Amber?
this year it's interesting because you're right. They're very different. Health, I mean, trying to bring the education
Hmm.
of what we do to our donors, because we need to focus on that as well. Like,
Hmm.
the night is beautiful and vibrant and colorful, and there's so much happening, but we can't lose sight of why we're there. So there's a tricky balance. And so this year we're inviting one of our kiddos. He's going to ring his No More Chemo bell on stage. That's how we kind of, yeah, it's can be a
Oh,
tearjerker. Um,
yeah.
but that's important because we need our audience to remember what we do, the work we do every single day.
The reality, yeah. I would
Yeah.
imagine, yeah. How do you keep the reality of everything front and center? So it doesn't get forgotten within the lights and the costumes and all of those things, which I imagine it's a really nice escape for the families as well, an escape for the children that are being affected every single year too. They get to have a day or a night or a few weeks working with this as well that lets them forget. how difficult everything is. But and how else do you educate during that time? Because this is a wonderful education for myself in learning and understanding what the battles are like, and what the operations are like, and all of the other facilitations that you do within Cure for the Kids, and then really understanding all that you go through and all that the families go through, and then the medical community goes through to engage and keep this entire effort and fight going. And I know, Annette, I would love to ask about your advocacy work, and you're a big advocate on the local, state, and national level. And I'd love to ask you as well to speak on what that has been like for you, and what are the important bills or initiatives around that are so important to this particular demographic of medicine.
Yeah, those are all wonderful things to talk about. I feel like we could talk for hours.
I
um,
bet.
yeah.
You do
You
so
know,
much.
yeah. To answer your first question about the night of how are we educating, we honor community partners and philanthropists of the year at this event.
Mm.
And we use this platform to showcase the great work. Like this year, for example, we're honoring Clark County School District because they have done something extraordinary with us, where they've partnered with us to bring a classroom directly to the clinic. And they've helped us create a hybrid educational model to keep these kids on track educationally. So many of them miss so much of their academic experience while they're in treatment. They're either in the hospital, or they spend all day, many days a week at the clinic, or oftentimes they're just not well enough to go to school. And so we'll take an opportunity to really educate about our education center during this particular evening. And then we're honoring a match by the Andre Agassi Charitable Foundation. They're matching dollar for dollar up to $150,000 for everything that we raised during the mission auction. And the mission auction piece
Wow.
of the night, because it's a big, wonderful show. And instead of maybe intermission, if you will, we have our mission auction, and where we talk about how we spend the money, why the money is important. Some of the years we've really showcased physical therapy and the need for a unique type of physical therapy service for these kids. And so we definitely educate, entertain, inspire, have a lot of fun, and raise money all in one 90-minute show. So it's very busy. It's it is timed. It's a complete run of show as if this was a major Las Vegas Strip show, because it really is. All of
Yeah.
those same elements go into this show. It is a real show with real talent. I mean, we are so fortunate to have some of the world's best talent right here in Las Vegas. And then it humbles me to think that they've kind of hooked their cart to my horse, if you will, and they help me raise money every year. They help me create awareness and advocacy initiatives every year. So that's a fun way that we educate through the show. And
Yeah,
then
just to put it,
go ahead, Amber.
I was going to say, just to put it into perspective, she was talking about the entertainment industry being behind us. So last year we had 374 volunteers that help us put on that show. So it's there's a production committee of about 30 that really work on the show about 6 months before. But the day of the show, I mean, there's nearly 400 volunteers there. It's really great. It's an awesome
day. It gives me goosebumps to think about. I mean, it's a perfect example of what a community can do when they really come together as a united front for an important cause.
Yes, I mean, you've had the Las Vegas Circus Center involved with Michelle and Bran, and they are absolutely amazing. I have done advocacy work with them. I've invited them into meetings with senators and congresspeople in DC, and they have been incredible advocates for the circus arts industry on a local level and on a national level. I'm very grateful for their contribution. They speak up, they talk policy, and they're really willing to put themselves out there and to support. They support events that I propose to them as well. They're so fantastic. I always tell them, thank you so much for being at least open to any of the ideas that I can cook up here that I think could maybe potentially be advantageous for the circus arts industry. And that speaks again to your work, Annette, with DC and on the local level. And I'd love to hear about that. And also too, how, any of us could support that on a local level and on a federal level as well.
Absolutely. So, I always say, even though Cure for the Kids has been around for quite some time and we've had huge success, I feel like we're just getting started. And that's really where our advocacy work is. We're just getting started. When I stepped down in January of this year as the CEO and appointed a new CEO to take on this advocacy and innovation role, I feel like the sky's the limit for us now. There are so many opportunities to do things better, more efficiently when it comes to how kids access healthcare. And, we have a lot of old policies that can be refreshed, that need to be refreshed through the legislative activities and initiatives. And so, the good news is, last session, we were able to put a bill through. It was called Senate Bill 221, and it created a new unique provider type for outpatient childhood cancer and rare disease centers, primarily because some of the things that haven't really kept up with technology and innovation in medicine has been healthcare policy, particularly as it relates to Medicaid beneficiaries. So to put it in perspective, at the current point right now, 54% of our entire patient population is a Medicaid beneficiary, meaning that they are at or below poverty level. And so, there's a lot of issues there. Transportation, how do they get to the clinic? And, how much time parents need to take off of work, and they might lose their job, which is the job that gives them insurance to be able to treat their child. And so there's lots of nuances to it. But we were really fortunate to be able to get our lawmakers to recognize that we need a different pathway of access for kids with cancer and rare diseases, because a lot of the highly specialized services and care that we provide are reimbursed at less than the cost of doing business, which is another reason why philanthropy is so important. But we can't rely exclusively on philanthropy to pick up the cost that really it should fall into the state's responsibility, right? We're all taxpayers and we all do it. So we need to help the state understand, because there are opportunities to take some of these old access models and turn them on their ear so that we can reduce the administrative burden of healthcare. So that, because we can't just keep raising the dollar amount, right? So we can't just say you need to pay more, you need to pay more, you need to pay more. We need to figure out a way to decrease the cost of providing healthcare, particularly with this particular patient population. So our lawmakers are key to having those conversations about how can we decrease the cost while increasing efficiencies and decrease the administrative burden, because it costs so much to even navigate the healthcare world from an administrative perspective before the doctor even gets to see the patient.
Wow.
And so those are areas where we really need to focus. And, coming up, a big initiative that I want to push through is, and I don't know how much time we have, but, I think this is a long time.
As much as you can, in a condense. We have a few minutes left in the podcast.
Across the country, we have what's called comprehensive cancer control plans. And since 1998, every state in the country, along with Puerto Rico and Washington, D.C., and some Indian tribes in Puerto Rico and all of those U.S. jurisdictions, have received some federal funding, which is great, to develop and implement a state or territory specific cancer control plan. And that's all amazing. But what happens is the children are often left out of these comprehensive cancer control plans. And not intentionally, but just because the way that the funding is articulated at the federal level, the initiatives are really geared towards adult cancers.
Mm,
Uh, and an example might be where they would say, "Well, we do focus on children, but they focus on children like HPV vaccines to decrease the amount of cervical cancers. Cervical cancer is an adult cancer, even though intervention
mhm.
can start in childhood, but that doesn't address a childhood cancer or even the big sunscreen initiatives. Believe me, I'm all for having sunscreen dispensers in every playground. But that is addressing something that happens most of the time in adults. So adult
Mm,
cancers are very different than pediatric cancers. And so I really want to influence the state of Nevada to put some funding behind a comprehensive childhood and adolescent young adult cancer plan that is separate from the adult cancer control plans that we see across the country. And because there really isn't federal funding for that, it's going to come from state funding. And so I'm going to
mm.
need legislative initiatives to help kind of rewrite that, or even not even rewrite, but write a new law, a new concept that I'm hoping other states can then follow.
Thank you so much for that, Annette. And you're the person to do it and to get it done. I mean, it's mind-boggling and heartbreaking to think that we leave children out of these very important policies. I mean, they should be the first beneficiaries, and I think the most important ones, in my opinion. It's our children, and when you find just so many policies that lack including children, I can't ever wrap my mind around that. It really,
And
I
it's
think,
tricky.
yeah.
It's tricky
Hmm.
because childhood cancer is considered rare. Right? So the numbers are very small, which is wonderful. I'm glad it's
Sure.
rare and I'm glad that the numbers are small. Where adult cancers are massive. And if you just look at
Hmm.
the breast cancer, prostate cancer, lung cancer, um, skin cancer, all of those things, um, colon cancer, those numbers are massive. And so you can understand that a lot of resources need to go to those areas. But what I would
Sure.
like to say is, a lot of those cancers are environmental and lifestyle choice cancers. Children don't have a choice in this. Oftentimes children are born with cancer. It's not something that they were exposed to. It wasn't a bad lifestyle choice that gave them their cancer. And so I
Mm.
believe that the same rigor and the same support needs to be focused on those childhood diseases, um, as much as, even if we were to calculate a percentage scenario that says, this many hundreds of thousands of adults get it, even just do a basic math calculation to say the same percentage of effort should be given to children and adolescents and young adults. And that would make a revolutionary difference in how we address research, how we address access, how we address the unique and very special things that happen in the childhood arena that are very different than the adult arena. And we need to bring attention to it.
Thank you so much for that education, Annette, and for helping us to understand what that is with respect to policy and how we can support to change that and what people can do to use their voices in changing that environment. Because, like you're saying, the other thing I wanted to speak to a little bit is that, the age of those getting cancer is dropping. Everyone's getting cancer younger and younger and younger, which seems to be a new epidemic within the cancer, those stricken with cancer, which is, I think, very alarming as well. But thank you so much for educating us in the podcast about that and an environment that maybe most people aren't coming into that much contact with. And I think, again, it's not something that I think anyone obviously wants to experience of having their child that is sick. I know for people, it's much easier sometimes when you get affected directly with something, but it's also what we do for others. And I think anyone's children is everyone's children. And I think it's very important to live by that. And I certainly do. And to leave us with the last like 1 minute or so, Amber and Annette, your last thoughts in sharing about Circus Couture and the overall spectacle of the event for this year. When is it happening? where can we find you? Where can people sign up, get a ticket, sponsor a table, and also to share it for their social medias and share it to their communities, either locally or throughout the circus industry, as you're accessing through this podcast. Everyone, I think, probably listening to this podcast probably knows at least one person that's participating in Circus Couture. We are a very small but very big family, and I've had friends and circus friends doing Circus Couture since the beginning, and I love Russ, and I'm so excited to be connected to Circus Couture in this way and to be at the show this year as well. So thank you for closing us out with your last thoughts.
Amber, I'll have you talk about the event first.
Okay. So it's May 2nd, 6:00 doors. It's at the theater at Virgin Hotels. We're back at the original. It used to be Hard Rock. It used to be the Joint. So we're super happy to be back there and back in a theater. It feels like home. So it's really nice. It's bringing a energy to this year's event already. Yeah, you can go purchase tickets. General admission tickets are still available. We're pretty close to sold out, so that's good as for the event, but there's definitely plenty of general admission tickets available still. That's the third floor. They're $35, and you can get them on Cure for the Kids website. So it's cure, the number 4, thekids.org. And you should be able to find it right on the site. On the drop down, it's Circus Couture, and you can purchase tickets. Anything else to add?
Wonderful. Well, I just really want to close with saying, we owe a tremendous amount of gratitude to Ross, to Ben, to Kathy Pachikian. I mean, I could sit here and go down the credits, right? We talked about some of the early founders and now the folks that are keeping this going year after year. It's such an honor that they give us their time and talent to raise money for the kids of Las Vegas. So a huge shout out to the entire Circus Couture team. Thank you, thank you, thank you. We can't say it enough. It is one of Las Vegas's, if not the coolest charity event, because it's so different. I mean, it is so different than any charity event that you'll ever go to. It's edgy, it's trendy, it's fun, it's exciting. I mean, it's such a cool event. I couldn't be more proud to be part of it.
And it continues to evolve every single year. I mean, this year we have not one, we have 3 fashion runway segments.
Ooh.
The highlight of the night.
That's something that we didn't really talk about, Amber, is the fashion. The fashion is out of this world.
It's fabulous.
It is so cool.
Yeah. And you can talk about it a little bit.
Yeah, matter of fact, I had a moment last night. I got a little teared up, actually, because we utilize this platform that we all can go and check in on everybody's progress and see kind of what's going on. And our one of our fashion designers, they're having touch bases right now to kind of check in to see where everybody's at. And it was just so fun to watch these videos and see where the designs are right now, because they're halfway done or 3/4 of the way done or whatever. But it just reminded me how much work goes into every element from so many people. And it was touching last night. I got a little teary.
Yeah, because the fashion designers work just as hard and maybe even harder. I don't know. But I mean, what they bring in their creative talent is just, I mean, every single year I think, oh, it just can't get better than this. And it just does. They just keep raising the bar. And it's a cool process to be part of.
Oh, yeah, that's fabulous.
The level of detail in, I mean, the choreography, the run of show, the thought process, every single garment, every single performance, every single costume on the artist. I mean, there's just so much thought and care that goes into I mean, it's a big group of circus folks, right? They can't help themselves but put 1,000% into it. And it's just so fun to be a part of every year. It's great. I'm just honored that I can be in this position every year.
That's beautiful. Those are wonderful, wonderful, wonderful sentiments. I am so looking forward to Circus Couture this year. Thank you so much, Annette. Thank you so much, Amber, for coming on to the podcast to discuss Cure for the Kids, your incredible efforts and initiatives. I mean, you're so amazing. Thank you for all that you're doing. And I hope that this podcast helps to generate support for Circus Couture and for Cure for the Kids. You do it so well, and your reach is so vast, and it really is just such a beautiful, cool, and rad event of the year. And the couture, I wore a puffy sleeve in honor of the couture fashion because I'll be looking forward to that, and I had a really great time picking out a dress. And I look forward to seeing all of the different elements for the show this year. And thank you so much. And I will close out the podcast with the Circuspreneur Podcast is also available on Circus Talk, now Stage Link, the inclusive, independent, and international online network for the circus industry. Stage Link's mission is to create a level playing field for this industry and democratize access to information. Until next time, everyone, I'm your host, Shenea Stiletto. Please stay safe and stay healthy and get your tickets for Circus Couture.